I'd like a job where I can help others in the health industry, but I don't know what I want to do.
Check this out. Sydney Southwest Area Health Service.
Wow, that covers a huge area.
It says here they look after 1.3 million people.
I wonder what types of jobs they have.
Here you go.
Wow, there's so many different jobs.
I haven't heard of half of these.
My name is Ali Padiki, and I work for Sydney Southwest Area Health Service. There's a lot more jobs here than people actually realise. I work in recruitment. We are one of the largest employers in the local area, and we're looking for people to join us. Nearly half of the jobs here are in nursing.
My name is Joshua Cohen. I'm a registered nurse that works in the community in inner Sydney. I do many things, but some of them are looking after palliative care patients in their home, post-acute care, and ensuring that people take their correct medications, things like that.
Hi, my name's Karina Costello. I'm an enrolled nurse. I work in the maternity unit, and I did the AIN vet course during my Year 12 HSC, and it counted for 3 units of my HSC. The vet course was a great experience. It gave me a chance to realise that nursing was what I wanted to do before I actually entered the training course.
My name's Brooke Hadfield. I'm currently an enrolled nurse. I did the vet traineeship in Year 11 and 12, which got me through to the TAFE course doing enrolled nursing, and I'm currently studying registered nursing at university.
As well as nurses, we have other medical staff such as doctors, specialists and researchers.
I'm Suhail Vivekanand Raja, one of the medical registrars. Went into medical school soon after finishing my high school, which was about 3 years after graduation from high school. I was then later employed as an intern, having completed 6 years of training at the university. Then went on to become a resident and then a medical registrar.
So, g'day, my name's Arvind Damodaran and I'm a physician and I also teach at Liverpool Hospital. Now, it's quite a long road to sort of getting to be a specialist, but it's a really interesting one. And I started off with an undergraduate degree in medicine, and then it's some years in physician training before you go ahead and get your qualifications for the College of Physicians. Hospitals are incredible places to work. A hospital like this one has beds for over 500 patients. And to make all of that work takes a lot of input, not just from doctors, not just from nurses, but from all of the support staff that you need to run a massive institution like this one.
I'm Sujan Mankata and I'm a medical researcher. I'm a psychologist and I also work in clinical trials. In high school I wasn't quite sure what I wanted to do, so when I got out of high school I actually applied for a Bachelor of Arts because it's quite open. And I did do a few psychology courses and a few other health type subjects, and I was quite interested in that. And so once I finished a Bachelor of Arts, I actually did honours in psychology and then 2 years further clinical training actually here in the hospital, where I trained with a psychologist that specialises here in sleep disorders, and that's when I realised that I quite actually enjoy working in this field.
About 10% of the people employed here work in allied health, that is, jobs related to medicine. For example, dietitians, occupational therapists, speech pathologists, dentists and community health workers.
My name's Kate Hobson. I'm a radiographer. I take x-rays and CT scans and work in the operating theatre. What I love about the job is that I get to work different day shifts and night shifts, have days off through the week and work on the weekends when more of the interesting cases are often coming in. I get to work with a wide range of people, both culturally and different age groups.
My name's Tanya Hazelwood. I'm currently the manager of the dietetics department at Liverpool Hospital. As dietitians, we see patients that are in the hospital or at home or in clinics to give them advice about healthy eating and nutrition to manage their health and be healthy.
I came from Lebanon some years ago and I studied journalism there. When I came to Australia, I decided to become an interpreter. Therefore, I enrolled at University of Western Sydney and I completed a Bachelor of Arts in Interpreting and Languages. And then I completed a master's degree in Translation, Linguistics and Interpreting.
A lot of people have the perception that the hospital is made up of doctors and nurses. When you tell people that you work here, they automatically ask, are you a nurse? About a quarter of the workforce in a hospital work in general support roles, such as trades, transport, administration, cleaning and security.
My name is Philip Beck. I work for Sydney South West Area Health Services as an electrician. My uncle actually found an advertisement in the paper for a first year electrician, and that was the exact job I was looking for.
Hi, I'm Tim Wallace and I work in IT. I didn't know that this sort of position was available in the health service. I just came across it in the newspaper one day and was surprised to find that they offer this sort of job to young school leavers.
Do you reckon there'd be much of a career path? I don't always want to be stuck in the same job.
I'd recommend nursing as a career because there's so many different opportunities you can get through nursing. You can do different specialties in different areas of nursing. You can also travel a lot too.
There are many career opportunities in radiography. You can further your study with CT, MRI, ultrasound, or also go into the sales of the equipment.
Career opportunities in this job are, quite varied. If you want to go into quite different kinds of research, you can do that, but you can also go into the clinical side of it as well. It just depends what you want. It's quite open.
Lots of opportunities for advancement in dietetics and in health. I've done several different jobs in the last couple of years. It's been really great.
As an interpreter, there are opportunities depending on the individual's ambitions and plan. For example, myself, I pursued a career path in training, interpreting and lecturing.
There's many different jobs you can do within the IT sector, and they will help support you and help you, encourage you to do whatever you like to do. I'm studying part-time at the moment, and that's going to help me in my job in desktop support.
Sounds cool. I wonder what it's like to work there.
What I like about my job is the time I get to spend with patients in their home. It's a very different dynamic to the hospital setting.
There's a lot of satisfaction in nursing. You're there when people are at their most vulnerable. Like, for example, now I'm helping new mums with their newborns.
Working in health is a unique opportunity. At the moment, you're considering all of the options in front of you. But I think the health industry or related jobs really gives you the opportunity to kind of go home at the end of a hard day or a hard week and think, I've really contributed something, beyond my own just career progression.
What I really like about the job, working here as an electrician, is just there's a great bunch of guys. I always feel like I'm at home here really, and there's just plenty of overtime and just great hours, good workplace.
I'd encourage you to consider working in a health service. It's a very interesting job and there's plenty of career opportunities for you here. We're working with cutting edge technology equal to what you'd see in any other organisation, and it's a very exciting place to work.
Working hard really pays off, and you get recognised for the hard work that you do. It's a team environment and you have to work closely with others.
When I was at school, I didn't know too much about nursing, but doing the traineeship helped me see that it was actually the course that I wanted to do and the career path that I wanted to take.
If you're considering a job in health, I would highly recommend it. Something that, when you go home at the end of the day, you've done something for the communities.
If you work consistently and balance your studies and hard work with other things in life, it is often possible to actually achieve what you want.
Sounds cool. I'm going to check this out some more. Maybe there's a job here for me.
Me too.
Business analyst.
Nursing.
Ooh, occupational therapist.
Physiotherapist.
Social worker.
Carpenter.
Cardiac technologist.
Podiatrist.
Podiatrist? What's that?
Check it out. Could be just the job for you.